Hello, my name is Bonnie Dobbs, and today we're going to talk about Medicare Made Simple. I have a wonderful group of agents who can help you. Our telephone number is 770-373-7541. There's never a fee for our services. We would love to speak to your group, your church or organization, or the media. And please know, this is for educational purposes only. We're not affiliated with the U.S. government, federal, or state Medicare program. Now, the resource for this presentation is Medicare and You. It is a CMS publication. You can get it by going to medicare.gov and downloading. So, how do you feel whenever you're trying to find out and learn more about Medicare? Do you ever try to sit down and read publications or articles on Medicare, or you call someone on the phone or several different of the companies or talk to agents and you just feel like screaming because you become more and more confused? Well, I know firsthand just how confusing Medicare is. So I'm going to try to put this in simple terms so you can understand Medicare. So we're going to start out with what is Medicare and how do I get it? Well, Medicare is health insurance. You qualify if you're 65 or older, if you're under 65 with certain disabilities, or if you have end-stage renal disease. Now, you must be a U.S. citizen or legal resident who has lived in the U.S. for at least 5 consecutive years. So, I'm now turning 65. What do I need to do? Well, if you've started your Social Security, your Medicare will begin on the first day of your 65th birthday. Usually you'll receive your card up to 6 months prior to your 65th birthday. If not, contact Social Security 2 or 3 months before. Well, what if I'm retiring and I'm after 65? What do I need to know? You need to apply for Part B 2 or 3 months before retiring because you want to make sure your Part B is effective and you have your card. The way you do that is you have your employer complete CMS form L564E, and you can get that at medicare.gov. You can download it. Once your employer has completed that form, then you can go to ssa.gov/Medicare-Part B-SEP. Now, if you can't remember all that, you can give us a call at 770-373-7541. We'll be more than happy to send you those instructions. So once you complete your information after going to that site, then you'll upload the CMS form that your employer completed, and you should receive information about 10 business days later. So, what if you're qualifying for disability and you're under 65? What do you need to know? What do you need to do? Well, first of all, you qualify if you're on disability for 24 months. However, there are certain disabilities where it is instant that you qualify. ALS is one of those. You must be on SSDI or SSI to qualify. So what is original Medicare and what does it cover? Let's go over the ABCs and Ds of Medicare. So original Medicare is your Medicare card showing your Part A and Part B. So Part A and B is original Medicare. Now Part A says hospital on there, but it also covers nursing home, rehab, and hospice. Part B says medical, but now that covers like doctors, all your tests, therapies, your surgical supplies. So do you need a Band-Aid or do you need a joint replacement? Part C is Advantage Plan. which is one way of getting your coverage, and Part D is for drugs. Now that one was easy, wasn't it? Original Medicare, what does Part A cost and what does Part B cost? Well, the way you get Part A is by paying into Medicare taxes, also known as FICA taxes, during your working years. So once you've paid in for 10 years, which is equivalent to 40 quarters, you have self-funded your Part A. So if anybody ever says Part A is free, no, it's not. You personally self-funded it. However, when you become Medicare eligible, you may not have any additional to pay. Part B. Part B cost for 2020 $144.60 for most. Now note I said for most. I'm going to go over that a little bit later. Now if you only have original Medicare, which is Part A and Part B, there's no limit or cap on your out-of-pocket expenses. So original Medicare pays 80%, and that leaves you owing the Part A and Part B deductibles and the other 20%. So there are two ways to offset those costs. One is with a Medicare Advantage plan, and the other is with a Medicare Supplement plan. Now, Medicare Advantage plans are offered by private insurance companies. They offer all of the benefits of original Medicare and may offer additional benefits like dental, vision, and hearing. But the one thing that a Medicare Advantage plan does that an original Medicare doesn't is an Advantage plan has a maximum out-of-pocket or a cap. Now, to qualify, you must be enrolled in both Part A and Part B and live in the service area. I always like to say a Medicare Advantage plan provides care for the headaches caused by trying to understand Part A, B, and D. Now, the other way to offset the cost of original Medicare is by purchasing a Medicare supplement plan. So Medicare supplement plans are also known as Medigap plans because they help fill in those gaps left open by original Medicare, like they help pay either some or both of the Part A, Part B deductibles and that other 20%. Medicare supplement plans do not include drug plans, so you must purchase a standalone drug plan. Some of the differences between a supplement plan and an Advantage plan is with a supplement plan, there's no network of doctors or hospitals. With an Advantage plan, there is a network of doctors and hospitals and providers. With a Medicare supplement plan, you do have a monthly premium, but then you have limited copays whenever you use it. With an Advantage plan, you may or may not have a monthly premium, but you do have copays and deductibles perhaps whenever you use it. With a Medicare supplement plan, no referrals are necessary. You can go to anybody in the nation that accepts Medicare. Some of them also have out-of-the-country benefits. With a Medicare Advantage plan, referrals are necessary with some of those plans. With the supplement plan, there is guaranteed renewable coverage. With an Advantage plan, it's non-guaranteed renewable coverage because these plans could change networks or service areas, and they have that option to do annually. Now, there's two ways that you can get a Medicare prescription drug plan. One is you can enroll in a standalone plan, or you can join a Medicare Advantage plan that offers the prescription drug plan built right in. What or who is IRMA and LIS? No, they're not two new gals in the neighborhood. So let's talk about LIS first. So Extra Help, or LIS, is also known as Low Income Subsidy. Now, Extra Help is a program to help people with limited income and resources pay for their prescription drugs. So if you're single and your income is less than $18,735 with resources less than $14,390, or if you're married filing joint and your income is less than $25,365 with resources less than $28,720. Now, this is for year 2020. then you qualify for extra help, also known as low income subsidy. Now, please note here, resources do not include your car or your home. The opposite end of that is IRMA, and IRMA stands for Income Related Monthly Adjustment Amount. Now that's a mouthful, right? So IRMA is a sliding scale table, and it's based on your filing status, your MAGI, your modified adjusted gross income, and your premium year. So there's always a 2-year look back. So for 2020, they'll be looking at your income for 2018. If you are single and make up to $87,000, or married, filing joint, and you make up to $174,000, then your Part B for 2020 will be $144.60. If you exceed those thresholds, then you can look at the scale and find out what category you fit in. Now, there's also additional IRMA for Part D, and once again, it's based on filing status, your MAGI, modified adjusted gross income, and a 2-year look back. We're not going to really talk about the donut hole today, but please make sure whenever you sit down with your broker to go over your plan options that they do explain the donut hole and how it could affect you. One thing I think is important for you to understand is how you can save on prescription drug plans. Did you know that all prescription drug plans, regardless if you have a standalone plan or if you get your drugs through an Advantage plan, they contract with pharmacies and also use mail order. So any of these companies usually have about 60 to 68,000, so it's not like there's a shortage of it. But if you go to a preferred pharmacy instead of a non-preferred or out of network, then just know you're going to always save money. And if there's any way possible, always use generic brands because they're going to cost you much less than brand. Now, I know there's some times whenever you must take brand, and if you have to, so be it. Do what's best for you. How do I avoid a penalty? This is a question I'm often asked, and people don't understand that there are time frames and guidelines for Medicare plans to begin. So my best advice is enroll in Part B, as in baby, when you first become Medicare eligible. Number 2, enroll in Part D when you first become eligible, and never go more than 63 days in a row without a drug plan, because if you will enroll on time and not disenroll, you will not incur a penalty. Now, there's certain enrollment times. I'm only going to go over a few of those here. Your initial enrollment, if you're turning 65 and you do not have a retiree plan, you can enroll in a 7-month period. That's 3 months before your birthday, the month of your 65th birthday, and 3 months after your 61st birthday. Every year from October the 15th to December the 7th, we have annual enrollment. Now, at annual enrollment, you can review, compare, and change a drug or an Advantage plan. Notice I said drug or Advantage plan. During OEP, which begins January the 1st and goes through March the 31st, if you have a Medicare Advantage plan, you can once again review, compare, and change, but this is only for people with Medicare Advantage plans. So you can get a plan during annual enrollment, take it for a test drive, and if you are not satisfied with your Medicare Advantage plan, you can either switch to another Medicare Advantage plan, or you can drop that Advantage plan and go back to original Medicare, purchase a standalone drug plan, because remember, you must always have a drug plan, and then see if you qualify for a Medicare supplement plan if you want medical coverage. Now, you don't want to drop your Advantage plan and try to get a supplement plan until you make sure that you have medically qualified for a supplement plan. Once again, talk to a broker and make sure that you do have enough time to do that so you don't end up without coverage. Now, one thing that's important is sometimes we have special enrollment periods, and those are times when you can change plans outside of annual or open enrollment. One of those is if you retire through your employer or union, because everybody's not going to retire during open enrollment or annual enrollment, right? So you have the option, a one-time option to change, to get into Medicare whenever you change your, retire from an employer plan. Another time is if there is a 5-star rated plan in your area, if you are released from incarceration, if you lose credible coverage, if you qualify for Medicaid or lose Medicaid eligibility, if you qualify for extra help, if you're moving back into the United States, if you're moving into a nursing home or moving out of a nursing home, or if you live in a nursing home, you have an opportunity to review your plan and change. And after all, if you're moving to a nursing home, you're probably not having a good day and your needs have changed. So you do have the opportunity to switch plans at that time. The number one time, though, that people get in trouble is whenever they move out of their plan service area. So did you know that even though Medicare is a federal program, it differs state to state and county to county? That's right. You could literally move across the street from where you live and be out of your plan service area. So anytime you move, please call your agent or broker to make sure you are in your service area, because if you move out of your service area, you need to change plans. Thanks for attending this seminar today. Medicare is all about you, and so is your plan. So start learning at least 3 months prior, and don't wait till the last minute. We are brokers, and we are here to help you. I hope you have a better understanding of Medicare. Please feel free to call my team of brokers, and we can help you. The number is 770-373-7541. There's never a fee for our services. Thank you and have a great day.